Hi, my name is Jeff Hauk. I'm a physical therapist and I'm passionate about treating patients. So that's why I'm doing this talk called What are PROMIS Outcomes and Why Should You Use Them Clinically? What is PROMIS? PROMIS stands for Patient Reported Outcome Information System. The PROMIS measures were developed by a collaboration of clinical and research scientists sponsored by the National Institute of Health. And here's their website called healthmeasures.net, where you can find PROMIS instruments and information about PROMIS. A key feature of these new measures are that they are generic or agnostic disease, which means they can be applied across different diseases. They were developed using item response theory, which is an upgrade over previous measurement approaches. And 3, the tools are available in short forms, which means pencil and paper tests, or more importantly, as computer adaptive tests. Having the tools available as computer adaptive tests, you'll see in this talk, is a key advantage. Now, PROMIS is meant to measure health-related symptoms across diseases. So over 300 tools were developed and continue to be upgraded in 3 primary domains of health. These include physical health, mental health, social health, with physical health examples being fatigue, physical function, mental health, anxiety and depression, and then new to clinical care is the assessment of social health, ability to participate in social roles and activities, or something like social isolation. And there's also another new measure which combines all of these. But nevertheless, what is clear is that these measures allow us to expand our assessment of patients. But let's start with what a generic measure is and what it means to use this clinically. So many people regarding musculoskeletal problems are used to disease-specific measures. So foot and ankle measure like the FAM for foot problem, the ODQ or Oswestry Disability Questionnaire for a low back pain problem, and so on. But we know that other health problems like cardiac problems, diabetes, and just lifestyle choices also influence physical ability. So the PROMIS scales take a different approach. Instead of making it disease specific, they just ask the question, independent of all of these different problems, how's the patient doing on that primary symptom or metric, and in this case, physical function. And you could see how this could be extended to pain interference or self-efficacy or anxiety or other health-related symptoms. So why are new measurements interesting clinically? Consider when we move from radiographs to MRI. A radiograph is 2-dimensional, primarily allowing us to visualize bone. An MRI is 3-dimensional and allows us to visualize both bone and soft tissue. So new measures allow us to see problems we couldn't see before, and as a result, develop remedies that are important to patients. So let's apply this to patients. So if we think about how our outcomes define the value that we contribute to healthcare, current measures focus on disease-specific outcomes associated with physical abilities and pain. So providers and insurers see us as bringing this value to healthcare. By expanding our sense or measure of outcome or what we assess and using generic outcomes, we can capture physical, social, and mental aspects of health and measure what kind of effects we can have on these aspects of health and expand our current influence on how we impact healthcare. Consider a patient that's pretty common with low back pain. We assess them using the Oswestry Disability Questionnaire and Pain VAS score. This assessment doesn't take into account comorbidities which are common in a 53-year-old male, and it doesn't address psychosocial issues such as self-efficacy or other physical issues like fatigue, which are commonly associated with low back pain. Using the PROMIS assessments allows us to expand our conversation about health with our patients and hopefully improve our impact not just on their current condition, but on risk factors for other health problems, as well as reoccurrence of their current low back pain episode. So you might be thinking this sounds too complex. It would be without good tools and computer adaptive testing. So why use computer adaptive testing? It's highly accurate, has low floor and ceiling effects, and is quick and easy to administer. So by moving to CAT, or Computer Adaptive Tests, we can obtain multiple health domains. This means our assessments can match the complexity our patients present with, learning about their mental and social needs as well as their physical. So how exactly does a CAT assessment work? So let's use physical function as an example. You first start with an item bank where you tally a bunch of questions that are associated with physical abilities. And then you hierarchically align them along a scale. We've done that here. And then we start to query patients. And so we start with a question somewhere near the middle of the range. And in this case, the patient answered positively. So now we're going to ask a more difficult question. And so that then let's say that they can't do that, and then we would ask a question to the left of that. And then we would continue this iterative process until sufficient accuracy is obtained. And we would use some formulas, of course, to do that. Okay, typically this requires the patient to answer 4 to 6 items, which takes less than 1 minute per scale. So you can see how this would allow us to include several different CAT-based PROMIS instruments in a single session with a patient. So now I get a CAT, but what's a T-score? PROMIS scales result in a T-score, or a standardized score. In this case, each PROMIS scale was standardized to the U.S. population using data from the 2010 census. What this results in is that a score of 50 is equal to the average of the U.S. population, and 10 points equals 1 standard deviation. So let's summarize using this graphic to the right. This graphic over here to the right shows items of physical ability hierarchically organized from low to high function. So we can see that PFA 55 is a low function item and PFC 33 is a high function item. And at the 0 point here, we can see this item here, PFA 7, and these other items are near the average of the U.S. population. Okay, and then these other items are more difficult and these are more easy. So once we've calibrated this to the U.S. population here, then we can apply these typical T-scores, so we can see the 50 is aligning up with the 0, and so all these items here kind of hover around 50, and then there's this PFC 33 item, which somebody would only be able to do if they were also able to do these other items, okay, which were greater than 1 standard deviation above the mean. This approach means you can understand where patients feel they are relative to normal. So this is their perceived functional ability relative to normal. You can also capture very low function. So somebody might, if they can't do the items here in the middle, then they'd be asked questions here lower on the scale, and vice versa for higher. And so this means that there's going to be very few floor and ceiling effects. And then we can add items to the scale, so that means that we can modify the scale, and but by maintaining this kind of standardized scale, we don't have to switch to a new questionnaire. So the reference is the U.S. population. There's very few floor and ceiling effects, and the scale can be modified over time. So the advantages of PROMIS CAT-based scales are they minimize patient and provider burden, meaning that multiple scales can be used in a single session. They can be used across many different abilities of patients. So you can apply the same scale to a patient who has very severe disease to another patient who has minimal effects of the disease. The reference is the U.S. population, so it gives your patients a perspective and the provider a perspective on where the patient sits relative to normal. And then one scale can be used across a wide spectrum of diseases, and that the scales continue to be used, modified over time. So in other words, you can know a lot about your patient and how they rate their symptoms very quickly. So why move to multidimensional assessment? It's to match generic health domains with treatments and outcomes, essentially targeting care and effectively matching our treatments with the needs of our patients. I hope this talk caught your attention and that you'll either go to the healthmeasures.net website, find out more about PROMIS, or email me your questions. And remember that courage is willingness to take risk once you know the odds. Optimistic overconfidence means you are taking the risk because you don't know the odds. And I believe that PROMIS allows us to have courage rather than optimistic overconfidence when dealing with patient care. And just to give a shameless plug to 2 new publications we have coming out, there's one here in Archives and one Journal of Geriatric Physical Therapy, both specifically about PROMIS and how to use them clinically. Thank you very much. Have a wonderful day.